with hyperhidrosis, you have the topical medications and then you have the oral medications. So with topical medications, there's definitely a lot of stinging, you get a lot of burning sensations, and sometimes you can get a very nasty allergic contact dermatitis, which is where your body now is reacting to the medication. So instead of now reducing the sweat, you start having blisters, you start having irritative, it looks like as if the skin is burnt off. And that actually makes your skin worse, because now you're allowing more allergens to actually even come in and bring the problem worse. So for example, now let's say you have hyperhidrosis and a secondary skin condition, now you're bringing in even a third. So with topical medications, first know what you have to do, try a little bit of an amount. I'm sure, Martin, you always tell them first try, see if it is working for your skin, and then use it. Not something that you just go one day and then you just start using it, you know. In terms of oral medications, unfortunately, oral medications, what we use is the anticholinergics. Anticholinergics, what they do is they completely remove or they reduce the sympathetic stimulation in your entire body. Now, what that means is that where your hyperhidrosis is, you will definitely get better, but so will you have side effects on the rest of your skin. And the commonest ones for that are usually heart symptoms, all right, and extreme dryness in other areas of the body. So for example, your eyes will really be extremely dry. You'll feel as if there's some things inside your eyes. The mouth becomes super dry, the throat becomes very dry. So you find that it's very difficult to even start communicating with people. You keep on, swallowing spit to kind of think that it's going to reduce. And number two, very important, the heart condition. So you feel the heart is racing, you know. Those are some of the commonest side effects. Then you come to headaches, you come to delirium, sometimes you have anxiety attacks, and as the dose progresses, you have even further side effects, sometimes even actually really nasty side effects. Now that becomes a problem because you don't know what dose to start, right? Every time you start a medication, it would be according to your kilo, according to what your severity of the disease and where you're presenting with, if you have any other comorbid diseases. For example, let's say diabetes or hypertension. Now, you go and you tell the pharmacist, nataka yodawa, and then he's giving you a very high dose. Now imagine what that would do to your body, right? Imagine you taking, let's say for example, if I give 2.5 milligrams and you go ahead and take 20 milligrams. Imagine that change in dose. What would that be doing to your body? Just think of it. You see, what most of us don't realize is that superficially we have a very different skin. But inside, what side effects you're causing because of drugs you have not thought of, or you have not really been prescribed, and you've thought of in forums, for example, internet, Google reviews, you know. You're thinking that you know better than the doctor. You're going to be very wrong. You're going to suffer quite some major side effects, and at times those side effects are irreversible. All right. So when you're looking at medications, always get a professional to help you. We medical professional or medical professions, especially when you come to dermatologists, have done not less than 15 years of studies. Why do you think it takes that long to make someone that professional? It's because of that understanding of the problem, and that's why you'd be at a better position to advise patients. Now you think that using 5 minutes of your Google time, you are better than us. It is very possible that you will actually bring more problems than good to yourself.